and welcome back to the Hatching for Health show, where our mission is to create a platform for people to share their stories, to educate the public, and to build a more compassionate community. I'm your host, Jessica Hatch. Today, I'm so excited to introduce Ellyn Kodroff, founder of the nonprofit CURED, campaign urging research of eosinophilic disease. Joining Ellyn is one of the CURED Foundation's research scholars and medical director, Dr. Josh Wechsler, an attending physician at Lurie Children's Hospital in the Division of Gastroenterology, Hepatology, and Nutrition, and the co-founder of Wechsler and CURED Laboratory at the Stanley Main Children's Research Institute. We're also joined by the Schroeder family, a local Houston family, here to share how eosinophilic diseases or disorder has reshaped their lives and how the CURED Foundation has helped give a path forward toward normalcy. We have Dr. Wechsler here with us now, so let's bring him on. Hi, Dr. Wechsler. Thank you so much for being here with us today. I'd love for you to kick off things by just telling us a little bit about this disorder and what it's like for the patients who are living with it.
Well, thanks so much for having me. I'm really delighted to be here and get to talk all about eosinophilic esophagitis, which I'm super passionate about. So eosinophilic esophagitis, it's a mouthful, so we just say EOE for short. This is a chronic allergic inflammatory disease. So it's chronic. Once you're diagnosed, you're typically going to have it for your whole life. It involves inflammation. So when we go to examine the esophagus, there'll be inflammation present. And like a lot of chronic diseases, there's complications. So the big complications are scar tissue replacement of the normal tissue in the esophagus. This leads to narrowing or constriction of the esophagus, which ultimately leads food to start getting stuck and not pass correctly. So many of the patients will experience the feeling that the food does not go down correctly or get stuck. And when the narrowing gets to be very significant, the food can actually get trapped in there, where we need to emergently go in with an endoscopy and retrieve that food, sometimes even stretch out those narrowings. Along the way, for children, this can involve things like feeding issues, vomiting, heartburn, chest pain, and even poor growth is something we'll see oftentimes in younger children. So a really significant disease in terms of the impact on the quality of life. Eating is so essential to our daily lives. It's a very emotional experience. And when that food goes through your esophagus, it's the very first thing that's happening. It really has an impact on your day-to-day experience.
Yeah, absolutely. So tell me a little bit, I guess, is this part of your profession, that this particular condition presents itself with clients that you have, or patients, I should say, coming in? Tell us a little bit about your background.
Yeah, so I became interested in gastroenterology, pediatric gastroenterology as a medical student. I was truly fascinated by the fact that you have all these symptoms that really impact your quality of life. You have a tool like endoscopy where you can really ultimately figure out what's going on. And a really good history helps you sort out, is it an esophagus problem? Is it a stomach problem? Is it a colon problem? Things like that. And then the ability to study patients that were really suffering with a chronic disease. And that's really true of children that have inflammatory disorders. They really suffer. So that got me interested. Even also from a very young age, even before I went to medical school, was very interested in the idea of doing research. So becoming a physician scientist, the idea that I would take care of patients with a specific disease and be able to study that disease back in a laboratory. So that really is absolutely true of my career currently. I am proud to be the primary investigator, the leader of the Wechsler and CURED Laboratory here at the Stanley Manny Institute at Lurie Children's Hospital in Chicago, where we study eosinophilic esophagitis and particularly how it impacts things like scarring, the role of specific immune cells. And we're very thankful for the support we have from the CURED Foundation to be able to do that.
It's incredible, like all that is, as far as this has come. I know we'll be bringing on the founder of the CURED Foundation later, and just knowing that it dates back so long and the amount of work that you guys have done and been able to accomplish in such a short time really is really incredible. And I think having, the location that you have there in Chicago, by creating that, research center, obviously has made a big impact in getting things further along than they could have been. Tell me a little bit about some of the daily symptoms that a patient that's been diagnosed with the eosinophilic condition.
Well, the classic symptom of eosinophilic esophagitis is what we call dysphagia. But this really manifests in two primary ways. For many patients, it feels like the food goes down slowly or gets stuck. And in many cases, they could just wait for the sensation to pass or drink fluids or cut the food a little smaller. For other patients, they really find a lot of discomfort in that and they start to modify their life. So they may avoid foods that are difficult to pass, chewier foods like meats, chicken, things like that, or drier foods like rice or bread. They may just chew their food for a really long time. They may drink tons of fluids when they have meals. And these can be symptoms that are common of the more classic presentation. But for other patients, it's actually more of a heartburn, pain, vomiting type of a
Mm,
presentation. And in many cases, the symptoms of EOE are not daily. A lot of times they could be a few times a week, or even in some cases, a few times a month.
really?
And this is challenging for some patients because it's hard to appreciate the impact this can have. And even for patients where the symptoms occur more intermittently, they still can develop that very significant complication of narrowing and again have that potential to present with food stuck in the esophagus in the emergency room that's going to necessitate that emergent endoscopy. So it's a variable presentation. It really impacts all aspects of when you think of that experience of food going into your mouth and you swallowing it right away, and all these symptoms that are occurring during or soon after that process. And again, can be daily, can be a few times a week, can be even more intermittent. But just really that risk of complications is, very much what we're concerned
Of
about.
course, of course. Well, Dr. Wechsler, this has been such valuable information. I still have more questions for you, so I want you to stay put. But I do want to go ahead and bring on Miss Ellyn Kodroff. So we have Miss Ellyn here with CURED, and she is here to share more about the mission behind the organization and the incredible work that they are doing. So, Ellyn, welcome to the show.
Hi, thank you so much for having me. I can tell you that in 2003, my 10-year-old daughter was diagnosed with eosinophilic disease. Dr. Wechsler talked mainly about having it in your esophagus. However, you could have it throughout your digestive system. And my daughter has it in multiple places. And we obviously never heard of this disease. And we were told that most likely she would not be able to eat anymore and probably have to live her life on a feeding tube. She was the youngest of three children, and obviously I was very alarmed and didn't understand why there was no research and why there was no medications. They did not have any approved medication. They did not know really how to even treat the disease 22 years ago. At that time, there was 1 out of 10,000 patients diagnosed. And I asked the doctor why there was no research. That was, that we took her to see. And he said, well, there was no funding for research. And I asked him how much he needed. And he told me $1 million would be a great place to start. And at that point, I said to him, I don't know how and I don't know where, but I am going to get you $1 million. And this was Dr. Rothenberg at Cincinnati Children's Hospital. And I went home and asked my friends and family if they would help me start a foundation to raise money.
It's
Here we
beautiful.
are, 22 years later. We have donated close to $8 million to research, and we have
Incredible.
donated to probably 12 or 13 different research centers around the United States. Our mission is to educate doctors, to educate patients, to be there when the patients need somebody to talk to or need help on where to see the best doctors. We have an education conference, and our most important mission is to raise the funding for research. My daughter did have to stop eating food at 14 years old, and
Wow.
she decided not to have a feeding tube, but she drank formula. It was 2 weeks before Thanksgiving, so right
Oh,
around
my
this time of
goodness.
year, we
Yeah.
had to tell her the only thing she could have by mouth was formula and ice cubes and Dum Dum suckers. It was heart-wrenching for her and for our family. I
Of
still get choked
course.
up sharing that story. But I could tell you after 22 years of hard work and donating and funding research, this year, just last week, my daughter had her first Thanksgiving dinner with our family. She had turkey and ham,
Wow.
mashed potatoes. She still has restrictions. She can't have dairy or wheat or egg, which is
Okay.
difficult. but hey, we'll take it. And we now have 2 approved drugs to treat this disease.
That is
However,
incredible.
these drugs will not cure every patient. Some patients, they don't help at all. And other patients, they might last for a long amount of time or even a short amount of time, and then the efficacy stops working. So it's still our goal. We still have so much work to do. We don't want to just make sure that my daughter is eating. We want to make sure that every patient suffering from this disease finds a better treatment and ultimately a cure for this disease.
Is able
so
to
it's
eat.
been my passion,
Of course.
to dedicate basically my life to making sure that this happens. And, at the time we started CURED, we had choices to work with other foundations or to start our own foundation. And we felt like we really wanted 100% of the funds raised to go to research. So
y'all have done an incredible job.
Anyone that works with CURED is a volunteer.
Yeah, you've definitely done an incredible job. I mean, so these 2 drugs that are now actually approved on the market, this just took place within this year, you're saying?
Past 2 years, I would say. One is Dupixent. It's a biologic. It's an injection. And the other is Eosinophilic. It's a very low systemic steroid. And they both are working for many patients, just not all patients.
Just not all. So just to kind of connect the dots here. So Dr. Wechsler, how did you and Ellyn actually meet as it relates to, the CURED Foundation?
Yeah, I was doing research here in Chicago. My lab was actually over in a different spot at that point as part of Northwestern. And my primary mentor, Barry Werschel, who's also my division chief, had started working with CURED and introduced me to Ellyn, and truly a fateful and valuable interaction for me. And I think she saw my passion at that point. I'm remarkably passionate about what I do. I really feel for the patients, and the incredible thing about CURED is they really enable investigators to take chances on things, to take risks, to do risky experiments that test really novel ideas or hypotheses, and then with that information that you gain, then go to an organization like the National Institutes of Health and try to get even more funding. And so this the role of a foundation like CURED to support research, it's remarkably important. It leverages opportunities that are sometimes hard to initiate. And for my lab, for sure, that's been an incredible thing.
Well, Ellyn, tell us how people can get in touch with your organization. Should they be, seeking out the research that you guys are doing to help their own children?
Sure. Well, we have a website, www.curedfoundation.org. My email is ELLYN, that's how I spell my name, at curedfoundation.org. And I'm happy to email and talk with anybody needing help. Trying to get a diagnosis cannot always be very easy. Sometimes patients struggle for years to get a diagnosis. If doctors aren't taking the correct amount of biopsies, they can miss the disease very easy. It's a patchy disease, so there has to be a lot of education for the physicians to understand how to diagnose. And then, of course, how to treat the disease and follow a protocol. So I'm always available to help patients, to guide them on finding the correct doctor. I'd say that's one of the most important things. We're lucky in Chicago to have Dr. Wechsler, and it's hard to find a doctor that really specializes in this disease.
Yeah,
so
absolutely.
We're always here to help in any way we can. And I just want to mention back, Dr. Wechsler just mentioned the National Institute of Health, and I've been very involved with our consortium that is funded by the National Institute of Health called CEGR. And unfortunately, we just applied for our last round of funding from the National Institute of Health. And anybody is involved with representatives or Congress people in their city. Actually, we were supposed to turn in a grant application during the shutdown, and it got flagged and sent back to us. The application did not go through.
Oh, no.
It's application PAR-25-1 case-438. We just submitted it again yesterday because the submission date had to be in before December 8th. And unfortunately, it came back to us again. The submission did not go through. So they don't even get to see it or review it. It's being denied before it even is being reviewed. And that's so upsetting because the CURED Consortium has put 100 doctors working together for this disease.
We do have to cut to a commercial break before we bring the Schroeder family, which I'm so excited to hear them brag about all that you've done in their lives. But I do hope that gets away to where it needs to be to get approved and assist you with your all the amazing things that you guys are doing. So thank you so much, Ellyn, and thank you, Dr. Wechsler. I really appreciate y'all being here and just sharing all this very, very important information for our viewers. So you guys have a wonderful holiday, and thank you very much.
You as well. Thanks so much for having us.
But before we cut to commercial break, we want to give a heartfelt thank you to all of our amazing sponsors who make the Hatching for Health Foundation possible. Your support allows us to share these important stories, to educate the community, and to create meaningful change. We couldn't do this without you, and we are grateful for your generosity. We'll be right back here after the commercial break.
Your private practice deserves more than sticky notes and missed calls. Funnelcake MD is the HIPAA-compliant growth platform built for doctors and dentists. Manage calls, texts, and emails in one secure inbox. Book more patients, cut the admin chaos, and keep your front desk sane. Try it free for 14 days with full white glove onboarding so you're running smooth from day one. Don't let outdated software hold you back. Sweeten your growth with Funnelcake MD. Start your free trial now at funnelcakemd.ai.
Funnelcake MD, all-in-one tool to grow your practice.
Have you been seriously injured in an automobile accident or 18-wheeler? Come on in to Thurlow & Associates, 713-CALL-TOM. Come on in, meet our attorneys and our friendly staff. Let us give you a free case evaluation. Hire an experienced attorney, more than 30 years in practice, and 10,000 satisfied clients. Thurlow & Associates, 713-CALL-TOM.
Welcome back from the commercial break. We are so excited to have Pari, Donavan, and Arianna Schroeder here with us today. They're here to share their story and talk with us about the incredible difference the CURED Foundation has made in their lives. So thank you all for being here.
Thank you for having us today.
Yes, so Ms. Schroeder, so tell me a little bit about Donovan's diagnosis and when that actually came to life.
Yeah, so Donavan was diagnosed whenever he was 3 years old, and at that time there were a lot of questions and a lot of research needing to be done. We didn't know that EOE had different kinds of subtypes, and that is something that the CURED Foundation has been able to support, and they've been able to give funding to CEGRS, the Consortium for Eosinophilic Gastrointestinal Researchers.
What a name.
Yeah. And through CEGRS, they've been able to publish over 160 journals and figure out the fibrosis within eosinophilic disease and the different subtypes. And when I look at treatment with my child when he was 3 years old versus the treatment with him now at 15 years old, and my husband was diagnosed in his mid-40s, seeing what my husband has to go through with treatment versus what my son has had to go through with treatment has been day and night.
Yeah.
Having the same disease with the same genetic components and such vast different symptoms
Really?
needs research, right? We have a long way to go. Whenever Donavan was diagnosed, we didn't have those treatment options of medications. What we tried to do was just control as many symptoms as you possibly could. Even as the years have gone on with being on these FDA-approved treatments, we still have a sick kid and a sick dad. And my daughter has symptoms, even though she doesn't have EOE currently. I'm not naive to the fact that there's genetic components, and CURED has been able to give that funding to find those components. And we've got a long way to go, but where we're at versus where we've been is vastly different.
Well, so Donavan, I've had y'all on the show a few times. I didn't realize the extent of an organization that y'all were tied to and helping you, which is incredible. But I want you to just kind of tell us a little bit about your experience from, you know, where it started to what they've kind of done in your life personally, because I believe there's now a medication that you're currently using. So just kind of tell me a little bit about that from as long as you can remember back.
I guess most of this is from like, it started when I was like 4, but like, I guess it started in my life.
Yeah.
I can't remember that. But we have like,
You don't have the opportunity.
man, I'm not very good at
that everybody is.
talking.
No, it's okay. But I mean, as far as like what you're able to, you know, your sister's eating this or drinking this, and it's like you've been restricted.
Yeah.
And the way that it makes you feel, and like the different aspects of what the condition has created.
Yeah, like we would go to like the grocery store. I would see all the food. I would smell it. I couldn't have it, and like it made me sad. But like I knew I couldn't have it. I think, like I don't think anyone in our family had dairy, or like our immediate family had dairy or anything that I couldn't eat, to make sure like there wasn't any cross-contamination or
Just kind of supporting, you know, the fact that
Yeah.
you couldn't eat it, and not putting it right there in front of you or next to you as well. So now that the shot that you're taking that's been FDA approved through all the research CURED has done, is this allowed you to kind of open up what you're able to consume?
yeah, like I'm able to eat about everything now, but I still have to eat it in moderation so I don't get too sick.
Okay.
Like I woke up the other day, just randomly, and I was throwing up from what I think was me being sick from eating something.
Right. But for the most part, it's been such a significant difference.
Yeah.
So like, obviously other children that have this condition, like for them to be made aware of this, that's on the market now, I think that's huge.
Right. When Donavan was diagnosed, diet elimination was a large part of treatment. Diet elimination has played a huge social factor into our family dynamic. This has bled over into school and other relationships. Having the availability to eat freely now has given him that socialization back. He's healthier than he has ever been.
That's great. Yeah, you look wonderful.
Yeah.
Like growing like a weed over here.
It's as close to normalcy as we've been able to have. As he's said, there's still symptoms. So this is a treatment option.
Right.
These are treatment options.
There's so much
and they
more
don't work for everyone. And we need a cure. We still need to open our pockets and give money to research so that we can get these kids, and now what we're finding, an astronomical amount of adults
having it as well. So Arianna, having a brother with this and a father diagnosed later in life, what has your experience been with it and just kind of being in that family?
I've learned that clearing your throat can be one of clearing your throat and having trouble swallowing are symptoms of EOE and inflammation in your esophagus.
Yeah, you've been around it so much. There's probably so many things that you don't even think of right now that you've learned, and how to manage it and support it, you know, as a sister.
It becomes normal. You don't notice that it's like weird, because at this point it's just normal for you.
Yeah, of course.
Arianna experiences dysphagia, the trouble swallowing that Dr. Wechsler was talking about, though her endoscopies are still currently normal.
Good. Okay. And you mentioned your husband, so at 40, so before that he was actually not having symptoms?
No, he's had symptoms. It shows how the disease can develop.
Okay.
Yeah,
It became
he
more
was
severe.
properly tested for it. in his 30s, and here again in his 40s. In his 30s, he didn't have it. In his 40s, he does. Donovan's actual first endoscopy, he did not have eosinophilic esophagitis, and at 3 years old is when he was diagnosed. So I have seen that the disease develops, and just through my experience and exposure through the disease, I feel like inflammation does contribute a lot, like Arianna was saying.
Of course. So what advice do you guys have just for other individuals that are maybe just learning their child's been diagnosed? Because I think you're fortunate to be diagnosed so young and to already start to explore, like, how can we help him, live a better life. But for those early on, what kind of advice would you give?
I think it's, if you're seeing gastrointestinal symptoms and you go to a gastroenterologist, that you make sure that Seeger's consensus is followed on endoscopy and biopsies, because you can get a lot of misdiagnosis where you miss the disease if you don't look for it properly.
Okay.
And so I think that pointing people to CURED to be able to find that consensus is something that is instrumental. We have to have patient education to get it to the physicians.
Of course.
With rare disease, not a lot of physicians know about it, and 95% of them do not have a single FDA-approved drug. So EOE is one of the few, and so we should hold on to that and continue to run with that, so that you don't have to have decades of suffering and irreversible damage.
Of course. Is there anything, just as it relates to Dell's relationship with CURED Foundation, is there any events or anything coming up where someone can participate? Of course, they could make a donation at any time, but is there anything that they could actually be a part of in the upcoming future?
Yeah, absolutely. We're always looking for fundraising because that's what's needed. I just want to point out that CURED has been able to take patients, families, researchers, and clinicians and unite them together to have better treatment options and knowledge for this disease.
I love it. So it sounds like a lot of the funds are going directly to the research, versus big lavish events, which is not a bad thing. That's a good thing. Right. And you really just get to the heart of what's needed. So, well,
I'm volunteers.
Absolutely. I'm so glad that you guys came out again and just could talk more in detail and learn more about CURED, and obviously get to see how Donavan is just excelling at life. So
thank you for having us.
Thank you guys for being here. And thank you all for tuning in. It is now time for our weekly golden egg raffle. If you would like a chance to win, all you have to do is send us a DM on social media to enter. But this week we are going to be giving out tickets for a magical night at the Houston Zoo to see the holiday lights. You'll be picked up in our stylish luxury Mercedes Sprinter van. So don't forget to DM us at Hatching for Health to enter, and you could be our next golden egg raffle winner. Be sure and tune in next week for more inspiring stories, valuable health insights, and conversations that truly make a difference. I'm Jessica Hatch, and we can't wait to see you next time.